Hey, I'm Mike Gilliam, and welcome to Let It Rip. You know, many of us thought by now we would be looking at the worst of the COVID 19 pandemic in the rearview mirror, that we would have turned the corner. But the Delta variant and vaccine hesitancy have slammed the brakes on all of that. We'll take a good hard look at the crisis, and it's Breast Cancer Awareness Month. We'll also discuss the disease and efforts to control it across the city and in communities of color. This is Let It Rip. We begin with the COVID-19 crisis. While cases appear to be leveling off and vaccinations increasing, at the end of the summer, we saw a surge in hospitalizations and death, largely among the unvaccinated. Many of the cases occurred in the southern states. Now there are vaccination mandates at the city and federal levels as the Biden administration tries desperately to get more jabs into the arms of Americans. At the same time, there is strong resistance from some who frame it as an issue of personal liberty and freedom. Are mandates the way out of the pandemic? Are they legal? We've got a great panel assembled to sort it out. Pamela Payne Foster is a physician and professor at the University of Alabama School of Medicine, who has partnered with the CDC on a project for the Minority Age Research Fellowship funded by the CDC. Henry Garrido is the executive director of DC 37, New York City's largest public employee union, representing 150,000 members. Brenda Walker is a community organizer for the Coalition for Public Education. And Janet Calvo is a professor at CUNY Law School. Welcome to all of you.
Thank you.
Dr. Payne Foster, let's start with you.
Yes.
What are the conditions on the ground in Alabama now?
So right now we are highly unvaccinated compared to the rest of the country right now. Fully vaccinated is still under 50%, where you would like to see it at 70% for herd immunity. So we still have a long way to go.
Do you think that mandates will help?
Mandates are necessary, especially with such great resistance, but I'm hearing on the ground that resistance is real. We've heard since Biden's announcement, some grumbling from employees about walking out, strikes happening, lawsuits happening. But I think that the only way that we can get to the herd immunity is really through mandates.
Henry, you support vaccines, but you have other concerns, right?
I do. And I think that from a practical point of view, mandates, the way that they've been implemented from the perspective of the employers, have not resulted in the path of the group of people who are resistant to take the vaccine. If anything, it has hardened their position even more. And so I think that in our case, we have been taking the position that people that have medical exemptions and religious exemptions should be allowed to continue to be doing that on those bases and continue to be tested on a weekly basis.
So is that your main thing, though? Your main objection is that you don't have the option to have testing to opt out or religious exemptions?
Well, that's part of it, right? So I've been in cases. This is a case that we don't want the tyranny of the majority to really pressure on the minority of the folks that may have extenuating circumstances by which they cannot be vaccinated. As I've said it publicly, I am pro-vaccination. I've been vaccinated myself, but I have found an incredible number of cases where the people cannot simply get vaccinated. I had a case this week of a member who had multiple sclerosis, who has been paying out of pocket to get pregnant and has been unable to do so, where the doctor specifically recommended that she did not get the vaccine because it may slow down her fertility process. That member is now being put out on leave. She's a zookeeper up in one of the facilities in the Bronx Zoo, and she's been unable to work and potentially could lose her health insurance by the end of the week if we don't come up with a process to allow her to apply for medical exemption.
So if I'm understanding you, then what you really would like to do is to have a process where someone in a situation like that could be exempt, but you don't think that everybody should not be under a mandate, right?
Well, I don't think that people should lose the job as a result of not complying with the mandate. And there's a difference, right? It wasn't a precondition of employment. I think the way the city has forced as an employer people to get vaccinated has been pretty drastic. I understand the health risk. We understand the health risk, but right now we believe that a mandate for vaccination should come up with a proviso that would allow those who don't want to be vaccinated to do a weekly testing. Because after all, you could still be vaccinated and be carrying the virus and spreading the virus. And that has happened, as we have seen many penetration cases across the city. We think it'd be safer if the city did an uptick of weekly testing for those who are not being vaccinated.
Mhm.
And of course, the vaccinated, it does lower the risk of death. It's a major
Right.
issue.
That is true.
Janet,
That is true.
Janet, are the mandates legal at the federal level, at the city level?
Well, that's a very good question, and that depends on the what the mandates require, what legal standards are going to be applied, and what's the context. So the context makes a big difference. The facts on the ground do make the difference. So you may have different views, different legal standards if you're in a healthcare context. Workers in healthcare context may be different than workers in a office context. Part of the problem with what you're asking me, is it legal? For what? So are you making constitutional claims? Are you making statutory claims? Are you applying federal law? Are you applying state law? It is quite complicated. And what I think there's sort of like this in this pandemic, we feel like we've failed to have, be medically ready for it, to be economically ready for it, to be ready to not have certain populations suffer real disparities because of it. But we are also not legally ready. The standards are not clear. The standards are not secure. There is no black letter law here. There are cases all over the country and different arguments being made. And I can share with you the different perspectives on the legal arguments. And the legal arguments also reflect the differences in the views in our society.
In our politics?
Yes.
Yeah. Henry?
The case that we have made, that we have pursued in the unions, both at the state, at the local level, is not whether the mandate, the vaccines are in itself legal or not, but that the city and the employer has an absolute obligation to negotiate the impact. That it is a violation of the collective bargaining law to implement the mandate without negotiating the impact to the workers.
Well, you're
That
in
means
a very tricky situation there, because what you're also trying to do, if I'm hearing this and reading this correctly, is you're trying to protect the unions in the future from the city being able to just come in and do things without going through the collective bargaining process, correct?
That's correct.
And in the past, there have been some public health laws that have superseded based on the health of the public to really mandate some vaccines. For example, measles for children and other vaccines. So it's not really unusual. It's just that we're in an unusual political climate that is really anti, because it's been so politicized, particularly here in Alabama. It's definitely politicized.
Right.
So it makes it very complicated.
The traditional legal standard gave a lot of deference to government entities that were trying to control epidemics. So the traditional legal standards comes out of a case called Jacobson. And Jacobson was a case in the early 1900s that involved the smallpox vaccine. And there the court, and this is still good precedent, there the court held that when a society faces a threatening epidemic, the constitutional rights can be curtailed when the society is attempting to make real and substantial measures that promote the public health and safety.
Okay. I want to go to Brenda now. Mandates appear to be here, but Republicans are promising to fight them all across the country. Brenda, do you see problems with vaccine mandates out on the ground?
Yes, I see mandates one of the main things right now that we're dealing with is so much distrust, and of course for people of color, for good reason. So distrust and mixed messaging. So, from one day to the next, things have changed. So people are trying to figure out, well, I don't know what to do. So we know everyone has a choice to make. And especially in the school population, when you're talking about, vaccinating children, and the whole way that the children were called back to school without a remote option, okay, so the teachers, you want to mandate them, but then what about the exemptions? There are some people that medically cannot be vaccinated. Some people have died because of these vaccinations, and that's just fact. So we need to stop with this separation, with blaming the vaccinated and the unvaccinated, separating us to have two sides of the coin, people being punished for not being vaccinated. This has got to stop. This is causing a separation and possibly a civil war, because it's basically going like the red against the blue. It's the Democrats against the Republicans, but we're in a health crisis. So let's work with reason and science at the same time, and stop strong arming people, because my son lost his job because medically he could not vaccinate. And they didn't give him a chance or opportunity to get the note that he needed to get from his doctor to state, what the issue is. Give him time to prove that, I have an issue. Let's find another, maybe there's something else that I can do where I can continue my employment. So I have to lose my job now because I can't be vaccinated because I have a medical condition. What about those folks? So you're mandating without that option. Come on now.
Okay, Pam, are you buying that?
Yeah, I mean, I also agree that maybe we should think of other alternatives to really encourage more and more people to get vaccinated. I'm working with a group now with the Chamber of Commerce, because we're really trying, and as a public health physician, I want us to get to herd immunity for public health reasons, to decrease the morbidity and mortality. But there is an economic reason to be vaccinated. We want to all get back to work. We want to keep Alabama working. We don't want to close down, shut down again. So those are all reasons. And what we're doing is partnering with them to actually do the vaccine clinics on site, on work sites. So, it is a public health emergency, number one. And so that's, from my perspective, why a public health mandate is needed until we get to herd immunity. Everybody, in the country doesn't have to have a measles vaccination if we're at herd immunity. That's the key point. Until we get to herd immunity, then you can have exemptions. But the encouragement should be for everybody to really, as a community, get back to work, keep everybody healthy.
President-elect Biden, before he took office, basically said he was against the mandates when he was asked about it. And things have gotten kind of muddy around that whole issue. Let's listen into him making that statement.
No, I don't think it should be mandatory. I wouldn't demand to be mandatory, but I would do everything in my power, just like I don't think masks have to be made mandatory nationwide. I'll do everything in my power as the President of the United States to encourage people to do the right thing, and when they do it, demonstrate that it matters.
He said it, but that was a long time ago, and conditions have changed. Janet, does that give the president the cover he needs to impose mandates?
Well, under the legal standards, if they can demonstrate, even on the most restrictive standards, if the government entity can demonstrate it has a compelling state interest, it can impose mandates even over constitutional objections. So if they have so the issue is, how compelling is the state interest? So what he's basically saying is the interest now is different. We're now in a situation where these other kinds of measures haven't worked. We're in a situation where the virus is winning because the virus is mutating and becoming more contagious through the Delta variant and others. That we have a great fear, the public health people have a great fear that we're going to return to the kinds of situation we were in the spring of 2020, when, the hospitals were overrun, people were dying. We're not out of this yet. His position and his CDC people, and also like the New York City Commissioner of Health, when you listen to them, what they're saying is we have an overwhelming compelling state interest in doing everything we can to stop the resurgence of this virus, because it seems like it's going the wrong way. So that makes their interest much stronger as they articulate that.
Okay, Henry, how would you respond to that line of reasoning?
Well, I think the problem we have is the political application to the science base and the legal cases that we've heard has not been consistent across the board. As you heard Ms. Walker talked about for the community folks. Like, is it different from a teacher working in the public schools in terms of the probability of the application of the same principle as opposed to a teacher in our early childhood education that in the case of the public schools, teachers, for instance, who are pregnant are able to apply for reasonable accommodations and be excused for a year. But a teacher with mostly Black and brown teachers in the early childhood education cannot. And in the city university, they cannot either. So why is different, right, for the Delta variant in terms of this case, as contagious as it is? The problem we're seeing is that the political application of the same principles have led to inequities and inequitable application of the same ideals that lead to, folks like us to continue to file litigation, because when you create those inequities, that's when you create a problem, you exacerbate the problem. It's not like the virus is going to stop in early childhood education and said, I can't go in because the mayor allowed us not to go in. And that has been across the board in many of the city agencies, police department versus fire, right? And if you look at what's happening with the museums and cultural institutions, where political applications of the same ideals have been inconsistent because of political pressures that have not led to a science-based approach in the workplace of the city as a whole.
Okay, bottom line, I'm just about out of time here, and I want to get this from you, Henry. Would you be satisfied if, in fact, you had the mandate, but there were provisions for some to opt out?
Yes, I think that's what we're looking for. We're looking for some to opt out. That means if people can take a leave of absence, if people can have medical reasonable accommodations based on the medical exemptions, religious exemptions, can they work remotely in some cases? Can they apply so that, can we take some measures of protecting those folks and not just necessarily say, well, if you're not vaccinated, you're going to be fired as of the 27th. We're looking for alternatives.
Okay, so there's a lot of controversy surrounding the issue of mandates for both vaccines and masks, and it promises to go on and on. We're going to check back in on the subject in the future. I want to thank our guest, Pamela Payne Foster is a physician and professor at the University of Alabama. Henry Garrido is the executive director of DC 37, New York City's largest public employee union. Brenda Walker is a community organizer for the Coalition for Public Education. And Janet Calvo is a professor at CUNY Law School. Thank you to all of you. We're going to take a short break. When we come back, we'll focus on breast cancer awareness and how the disease wreaks havoc on African-American women and other women of color. I'm Mike Gilliam, and this is Let It Rip.
You're watching CUNY TV, the City University of New York.
Welcome back to Let It Rip. I'm Mike Gilliam. This is Breast Cancer Awareness Month. It's about saving lives. About 1 in 8 women in the U.S. will develop invasive breast cancer over the course of their lifetimes, and the death rates are second only to lung cancer. Black women are less likely to develop it, but 40% more likely to die from it than white women. That's according to the U.S. Centers for Disease Control and Prevention. So the push is on for early detection and treatment. Here to shed some light on the problem, we have 2 guests. Dr. Lori Margolis, Chief of Breast Imaging at Mount Sinai Health, which has a mammogram van serving the 5 boroughs. And Yvonne Ruby, she's a breast cancer survivor, health educator, and public health consultant who participated in the first White House Health Summit under President Barack Obama. Welcome. Yvonne, let's start with you. Why is the situation so dire for Black women once they're diagnosed with breast cancer? Is it because of healthcare disparities?
Disparities is a huge issue throughout our health history, right? And so, yes, breast cancer plays a role in that whole disparity piece. Sometimes there is not sufficient access. Sometimes we're not given the right amount of care and follow through. So there's a lot of issues that have to do with that. But within that context, we also want to rev up and allow our women to understand that we do play some role in this in terms of making sure that we are checked and we are screened, whether it's breast cancer screening or whatever other health issues that do exist.
Can you talk to us just a bit about when you first got your diagnosis?
So what I found was important for me was breast self-exam. Now I know that the American Cancer Society does not no longer includes that in their guidelines, breast self-exams. But however, they do also say at the same time that it is important for a woman to understand what her breasts are supposed to feel like. What does it feel like normally in terms of the touch and the texture and so on, so that within the 11 months, every 11 months, excepting the one that you go for your breast cancer once a year, you can be doing that exam. And so that if you detect any kind of problems, if there's a change in the texture, you feel a lump, whatever the case is, you can call and speak with your doctor. And so that's basically what happened with me as well back in 2005. I had just finished a marathon, came back from Florida and Disney Marathon, had a wonderful time, all of that. And then I just, had a feeling, said, I haven't done my breast self-exam in a while. And I went ahead and did it. And bam, I felt this unusual lump on the left side of my left breast. So it was important that I do that. Now, please make sure that we understand, I'm not excluding mammograms, annual mammograms. That needs to happen. But between those mammograms, women should be looking to get themselves self-examined. And if you have a gynecologist, which I hope all of our sisters have a gynecologist, as well as a PCP, primary care physician, that person can teach you the correct way to do a breast self-exam. So yes.
Dr. Margolis, as she just mentioned, part of the problem is resources and early detection. Are you working to correct that by using the Mammo van? Tell us about that.
So the mammography van does some very important things. It removes some of the barriers to access in some very subtle ways and some very obvious ways. So one obvious way is that it goes to where people are, typically where people live, but perhaps where they work. So if it's difficult for people to get somewhere, this is right in their community. It also removes some of the fear or embarrassment or the need to plan ahead because it might be parked right in front of the healthcare facility that you go to normally, or right in front of the supermarket that you frequent, or right in front of the church that you go to. The other things that it does is our mobile van does not require you to have a prescription. And we have found that very often is a barrier to getting a screening mammogram. Having to go to the primary care physician or the gynecologist and get the prescription may prevent somebody from getting that mammogram.
Because it's too many steps
Exactly. Too many steps. Just that extra step is just a little bit more of a barrier. Mm-hmm. And then, of course, we have to talk about money and finances because that is critical to access. Right. So what happens on the mammography van is that if you have insurance, fine, we take almost every single insurance that exists, but we also are connected to New York State's Cancer Services Program. So that means if you live in New York State, whether you're documented or not, if you meet certain income requirements, you can get your mammogram as well as your cervical cancer screening elsewhere and all for no cost. And that's very, very important.
As we came through the pandemic, that a lot of people put off medical things because they just didn't want to go near the hospital. Maybe people didn't get screenings because they were concerned about COVID. What would your message be to anyone who might be in that particular boat? I'll start with you, Dr. Margolis.
We're ready to catch you back. At least in the New York City area, we are absolutely ready. The hospitals, the healthcare facilities are open for business. We have all the PPE, all the masks that anybody needs. We have all the cleaning protocols in place. We are open for business now. It's safe to come in. We are not overwhelmed the way we were at the beginning of this pandemic. We are open for business, and now it's time to come back and get back to your normal healthcare screening.
Yvonne?
Let's get ourselves checked. Let's go on ahead and take charge of ourselves and get checked. And there's so many programs out there that are willing to help. The program that Dr. Margolis mentioned, and Mr. Give Me Your Hand. It's a great opportunity now to be able to take advantage of those programs and see about yourself. Yes, COVID is real. Who knows how long it's going to be around. Masks are the best thing ever that happened, and of course, being vaccinated. So having those things available to you, especially the masking, will help you feel better in going into those environments, which are medical environments and which really have pumped up the volume in terms of care and being able to make sure that things are safe for women to go back. It's important for us to feel empowered and to know that we can be in charge of our bodies and therefore need to go and get checked.
Well, that's going to have to do it. Lots of important information. The message is get screened annually and take care of your health. Thanks to our guests, and thank you for joining us. I'm Mike Gilliam. We'll see you next time on Let It Rip.